Let me introduce the first panel. Deval Sanghavi will be the moderator, and this panel is on Indian philanthropy's transformative movement. Deval is the co-founder of Dasra. I'm sure many of you know him. And without further ado, Deval, let me turn it over to you.
Thank you so much, Sanjeev and the entire Indiaspora team. This is a real honor, and I'm really excited that you're able to do this online. I've been fortunate a few years ago to attend one of your sessions in DC and have been supported by MR for many years now. So it's great to be able to do this in India. And I think this panel is just fantastic, since each and every one of these individuals actually have played a critical role in my own journey in sort of the development sector here in India, and they have supported us in various different scenarios, from joining giving circles, funding research reports, helping us forge a partnership with Harvard Business School to create greater sort of nonprofit leaders with Kasturi Rangan and others from the HBS faculty. And so it's really great just to have Amit, Ajay, and Rati on this panel today. And with that, Ajay, we're going to start with you first.
Yep.
How was your thinking as a philanthropist? How has it sort of evolved over the years, and how do you see your philanthropic activities being impacted by COVID and the challenges that it's thrown up over the last 6 to 7 months?
First of all, let me just begin by congratulating the Indiaspora, the tremendous work that y'all have been doing, both in the US and India. I think really inspirational your work has been. So looking at our initiative, we've been in philanthropy for many decades, but a couple of decades ago, I realized that to make an impact in India, you had to have solutions which were really indigenous to India. We've had the same problems, whether it's in education, whether it's in health, and so many other issues. So we decided that what was of interest to us, and we felt that education and health and clean drinking water, these were the three big initiatives. So one, I think I've also realized that to do these initiatives in India, you need to have people who are running this have a passion for it. And we were fortunate that we could find leaders of these initiatives who were really passionate, who did it because they wanted to make a difference in the lives of people. So I think that's the first and important thing I realized. Second thing I've realized is that innovation always involves risk, and risk can only be taken by private foundations, NGOs. The government cannot take risk, and therefore if you want to find solutions which are applicable to India, you have to take risk. And I've seen that when you do that, when you get new solutions, whether it's with Pratham, whether it's with some of our initiatives, you can make a difference. If you can provide solutions, and then you need to do it in scale. Because in India, as you can imagine, with 1.3 billion people, you need scale to be done. And the role of a foundation or an NGO is to be able to demonstrate to the government, to the officials, that you can make a change at scale. And then ultimately, we've seen that the way to scale it up is to partner with government. As big a foundation you may be, you cannot make a significant difference in India, cannot move the needle unless and until you have scale. And this is what we've been doing. We've been partnering with government. I just want to take one big initiative that we've started over the last 2 years. That's on the aspirational districts. The Prime Minister has identified 112 districts, which were in some ways the most backward, and which were the sustainable development goals. If you looked at them, their parameters were the worst. So he said, why don't we all focus on them? And we decided to work in 25 of these 112 districts in the areas of health and education. I'm really happy to say that this has made a difference, and it has made a big difference during COVID. Just to tell you, in health, the biggest focus the government has put is on maternal and child health indicators. And we worked on this, and we found that the registration of pregnant women for antenatal care services has gone up by 21% in the last 2 years. Institutional delivery, which is a big thing in these districts where most of them would be done at home, have also gone up by 16%. And these are not data which we have collected. The Niti Aayog or the government has an independent agency, ID Insights, which looks at it. So they found this. Breastfeeding, we've worked on every area to see that breastfeeding goes up immediately after birth. We've worked with faith leaders all across these districts to see that you can have vaccinations and so on. In the space of education as well, I think we've made a difference in that 2.2 million community members have participated in what is called the Jan Andolan to ensure that kids go back to the government schools. It's a sad part that people who do not have, whose income is very limited, and where government schools are free and sometimes better than private schools, people don't want to go in to government schools. So we've done that. About 120,000 kids who had dropped out of the schools from government schools have come back. So that's a saving for the community. We've identified 5,000 schools in these 25 districts to make them as what is model schools. Again, government public schools, which is meaning that school learning levels have also gone up. So this is what, and the assessment, which was again done independently, has shown that school learning levels have shown a 14.3% overall improvement. So these are all government schools. So during COVID, we've been working there as well.
No, thank you, Ajay. That's fantastic. In fact, we featured some of the work you've been doing on the health side in aspirational districts in the Making the Case for India report last year. Absolutely phenomenal. Amit, I'm going to turn it over to you. And, you know, Ajay spoke about scale and how critical that is, as well as working with government. And I think you've been a firm believer in this in the 20 years I've known you. It would be good to hear about some of the initiatives that you've sort of been part of or even anchored in the last few months, again, when the lockdown happened, specifically related to COVID, and what are some of the successes as well as learnings that you've seen in creating sort of and maintaining these collaboratives?
Sure. Thank you. Namaste, everyone. First of all, again, thank you for inviting me here. It's great to be amongst friends, Rati, Ajay, Deval, you, and everybody else. I must first of all start by saying that a lot of what Ajay and Paresh and team have done has influenced the thinking at Chandra and my foundation. You know, and a lot of the work we do in sustainable rural development, we've been inspired by some of the scale initiatives and the partnerships with governments that I've seen firsthand play out with the work that Piramal Foundation has done. So, you know, people like us do get inspired a lot with, you know, what we observe. You know, people like Ajay and others do, you know, who have treaded the path before us. You know, coming to your question, Deval, look, you know, the first thing that I observed when we started, you know, engaging with the problem at hand, we repurposed our entire team at the foundation to actually fight COVID. We put pretty much all our activities at hold early in the month of Feb, actually, because of what we were seeing, you know, thanks to the work that that my on the for-profit side that I do at Bain Capital. We got to see what was playing out in China, in Europe. And so, you know, I realized that something pretty big was going to hit us. And so I at least got a foundation team to kind of, you know, put everything else on hold and start focusing on the disease full time. And my sense was that we are really fighting an enemy we just can't see. But yet this is potentially going to be a war that, you know, we've, as a world, haven't fought. And it's turned out to be a battle that's unparalleled since World War II. It was pretty evident even back then that it would require collaborations of all sorts, collaborations between civil society organizations and governments, collaboration between governments. I mean, you name it, that unless we really, even though this was an enemy that was invisible, we would only win this war with collaborations. And so at the local level, we've tried to really forge as many collaborations as possible. Ajay and I have worked very closely with the state government as well as with the local government, the BMC as we call it, in a collaborative manner. I'll give you a few examples, but the objective of these collaborations have been to get minds together, because often if you get people together, you get better ideas. So it's to pool together minds, it's to pool together resources. Some things can only be done if you have critical resources and critical amount of capital together. Importantly, so that people don't work at cross purposes. So it's with those objectives that we've collaborated very extensively through this entire period. And I'll give you three examples of collaborations in three different periods of fighting the pandemic. Very early on, we started getting calls, about impeding crisis, which could have been pretty bad, right in the slums, because essentially the authorities locked down, as you know, our slums in a very airtight manner. And virtually nothing was able to go in or get out of the slums in order to control the disease. Now, the implication of that was essentially people needed to be fed, and they didn't have access to either capital and they didn't have access to food. And so a few of us, 4 or 5 of us, Ajay included, we got together to really devise a feeding program for tens of thousands of people. Supply chains were completely broken in the entire country. And so we needed to build a distribution center right in the middle of Mumbai. We needed to get together 400 volunteers. This required help from the municipal corporation, help from the police, but importantly, getting 400 volunteers to step out of their homes when there was fear of death, come together, and then get supply chains from different people who could really bring in grains, tons of material every day from different parts of the state into the city, pack all this together on a 24/7 basis, and then distribute it out into the slums. We distributed 10 million meals over many weeks. This required not just the BMC, the state government, it required NGOs, because we had multiple partners. Different NGOs were strong in different slums, because you needed people to know who the most needy beneficiaries were in each part, and required many donors. Because raising money for 10 million meals was not. So we were 4 or 5 of us who got together, and we had to do this really quickly. We didn't have a lot of time to do this, because you would have had a law and order problem along with a humanitarian crisis. So we had to do this literally in days. So we put together one of the largest feeding programs in one of the shortest periods of time, along with a massive logistical overlay to it. That was just one example. We then, at a later stage, we realized that we needed to, really think about data and insight, because the country was essentially in a state of lockdown. There were, economic consequences to the lockdown. At some stage, we started worrying that the economic consequences would cause as many deaths as the disease itself, that people were getting denied healthcare. So we realized we needed much more data-driven insights to fight the disease. So we put together a consortium, again, worked with BMC, TIFR, THCI, a central government agency, IDFC Institute, and us and the Godrej family actually funded the largest seroprevalence study in the country and probably in the world at that point of time, launched it out of Mumbai. That actually has then become a template for running seroprevalence studies across the country. And actually then that study got so much of coverage that seroprevalence studies then became very, very prominent, and the New York Times covered it, CNN covered it, BBC covered it. So we actually did 10,000 samples over a period of a week in the first phase. Very complicated logistical exercise, again, trying to go into slums, non-slums. It was much more complicated raising samples, non-slums than slums, to draw blood and explain to people why we are doing that. But, we needed to do that. Out of that study, then We again worked with TFR to, run highly complicated simulation models to help the governments understand what the interplay between different parameters are for economic consequences and reopening. So again, this was another example of building a collaborative. And then more recently, the disease has not showed signs of really dying down. But the good news is that, we've figured out what it takes to deal with it. So we've really figured out that the need is to build ICU capacity in the city. That if you can really build ICU capacity, we can have some semblance of normalcy. So we've again built a collaborative, and we built the largest ICU COVID hospital in the country, 219 beds, again, a collaborative between BMC and NGO and a few donors, us, Mahindra's, HDFC, and we've got that up and running now. And that will actually last us for a reasonable period of time. And we built it in a manner in which once, COVID ends, you'll have a lot of ICU capacity there. So what do you do with that? So we built it in a flexi way in which that ICU can essentially be dismantled and equipment can be distributed across the state to other needy hospitals, and rural infrastructure can get built. So we've tried to build collaboratives, but I'm pretty sure if we tried to do any of this ourselves, it would have been only a fraction of the effort.
No, thank you, Amit. With that, Rati, I'm going to go over to you, and I think just like Amit was just talking about the different hats that he's had to wear over this period. I know you also, whether it's been as an individual or sitting on boards of NGOs or through their family foundation or even corporate giving, you've also been extremely involved and engaged over the last 6 months. It'd be great if you can talk about some of your examples and initiatives that you've been engaged with during this period.
Thanks so much, Deval. I think I'm mindful that we're speaking to an audience based in India as well as in overseas. So I'm going to try and cite a few examples which are I guess could be relevant in both worlds. I think both Mr. Piramal and Amit really spoke about the equity gap, which has worsened so much because of COVID. And this is apparent in every social space that we know, education, health, and wherever we look. And one of the key verticals that we have always focused on in our foundation, apart from education and health, is really the resilience of the social sector. And I know Amit's foundation also focuses on that as well. So I'm just going to talk a little bit about that really and see how can we more thoughtfully and meaningfully approach this part, and how can we build a more resilient social sector, given that it's absolutely key and essential that we have robustness in our social sector, as we've seen, especially during this current crisis. So what we did was to try and talk to a bunch of small and medium-sized organizations that we support. And we realized a few things which I'm just going to share. One is, one of the approaches that we quickly realized is it's time for us to give very unrestricted funding tied to projects, to initiatives. This is really not the time to ask for impact and so on. And I firmly believe that at least for a year or 18 months, we need to handhold our social sector partner organizations, helping them to pay salaries, to pay rents, and so on. Very early on, we also, during these conversations, realized the pain that they were going through. And so we ran webinars and seminars. In fact, Dasra was one of our resource partners on approaches such as program design, effective finance management, alternate business scenarios. And we ran them in both a mix of Hindi and English, because many small and medium-sized CBOs and NGOs just cannot cope if we run them entirely in English. We were also, as I'm going to just say that we are also huge advocates for collaborative approaches. And in our own city in Pune, we actually collaborated with the local government all across Pune district. As many companies have done, we repurposed our cafeteria. We had thousands of meals going out, working with our cooperator and the local volunteers, as well as now, building an isolation center. We also have a very dynamic CEO of our local Pune district, district. And with him, we catalyzed the entire public distribution scheme across the district. And I think one of the things that we have found very powerful, and we will continue to work on, is how can we work with local NGOs and CBOs to catalyze government schemes. This is another thrust area which has certainly gained momentum during this time. And as we all know, government outlays to health, education, and other social issues is about 23,000 crores. And whatever philanthropy we can provide is really a drop in the ocean comparatively. So we believe that how can we catalyze these schemes and sort of partner collaboratively with local government to see how each of these schemes can really reach the target audiences and areas. And finally, as a family, really, we decided very early on to support small enterprises. These are enterprises who are sort of like, you know, mom and pop store kind of things, but they were artisans. Some are in health food supplies. We had supported them by giving them advance orders. Many of them were not support in monetary terms, but we helped them, you know, with every kind of support that they required, just understanding the need. And thankfully, we find that most of them have been able to get back very quickly to, you know, sort of pre-COVID days. One fact that I'd like to just leave with the audience before I turn it back to you is a recent Sattva study showed that 90% of Indian everyday giving is to religion and to community. Although per se, I really think there's nothing wrong with this. I truly believe this is an inflection point in our country to consider and think about more meaningful, strategic, and thoughtful ways we can give. And I think really some of the examples that I've cited have not required large outlays of money, but really more thought, consideration, and time.
Thank you so much, Rati. I really appreciate that. And you're completely right. I mean, all money is required right now, and time, and it's not about the larger checks. It's actually about what you can give. And clearly the need, as you were saying, is far greater than we could have ever imagined before this crisis hit. We only have 5 minutes left, so this next round of questions are somewhat of a speed round. I apologize for that, but I know, again, Sanjeev has told me there's a very tight schedule, so we can't change that. So Ajay, if you can, in a minute, tell us one change that you feel is required in the philanthropic landscape of India going forward.
I think one of the things, I think Rati spoke about it, I'm just going to continue, that we have a lot of NGOs in the country. I think there's some 3.1 million NGOs. There are more NGOs than there are hospitals, and there are more NGOs. There's an NGO per 400 people compared to policemen for every 700 people. I think what you need to do is to see how these NGOs can have a long, sustainable life, because very often it's the passion of one person that goes on, and then the good work that's being done with them dies after that. So I think we have to look at it. And I just want to talk a little bit about the tribal health sort of platform that we are creating. Tribals form about 10% of the population. And this is, if we can make a change in health, we can change the sort of face of the country. And I'm very happy to say that we are working with many collaborations. The Bill and Melinda Gates Foundation, Rockefeller Foundation is there, a potential partner could be the Wish Foundation. And there are many other specialists, technocrats, the government of India. So I think we need to somehow see that how we can also engage the smaller NGOs in these larger platforms, so that all, because some of them have more passion and better ideas than the bigger ones. How do we get them together? I would leave that thought for everybody, because that will make the big difference and can move the needle in the country.
Thank you so much, Ajay. Amit, over to you. I guess my speed round question for you is, what are some bold and innovative shifts that are required to move this sector forward?
I want to build a little bit on what Rati said. My own sense is that the sector has always had a lot of heart in it. Without losing any of that, we need to put in a little bit more of science and process into it so that we can really move forward. I personally feel we actually have a lot of resources both within the country and amongst our diaspora. We need to find ways to get more of those resources to come to the organized sector. To Rati's point, for example, a lot of giving goes to unorganized sector, temples, churches, gurdwara. Nothing wrong in that. As long as it generates the right outcomes, it's okay. But more giving towards impact would really change social outcomes. So I would say the second thing is, how do we really increase the giving pie? There's enough wealth in the country, but if you look at data, by and large, we are poor givers as Indians. Even our neighbors, all of them outstrip us. So how do we get Indians to just give more, right? Particularly at the middle and at the top. At the bottom, we give reasonably well. It's actually middle at the top. How do we get people to give more? I think that's the second thing. If we get people to give more, and if then the giving goes in the right way, I think we will actually be able to solve a lot more of our problems.
Thank you so much, Amit. And Rati, it's great for you to end this session out. And I think in addition to philanthropy, which of course is a topic that needs to be spoken about, and behavioral change, Amit, like you've been saying across the board, I think, Rati, you've actually been engaged with the corporate sector, even in these difficult times, to really change the way they treat their laborers, those that we know, the 100 to 200 million who have suffered through this crisis, and honestly have been suffering well before even the crisis hit. But unfortunately, we just turned a blind eye towards them. So if you can speak a little bit about how family businesses and corporates are really coming together to create greater equity and dignity to their workforce, that would be fantastic.
So I'm mindful that we have 1 minute. So I will be very quick and say that I think people like us in companies, in corporates and in businesses need to also be advocates and have a greater voice around key issues. So one of the issues that I think we all saw dreadful images of in our media were the gross inequity that we saw in India's migrant workers. And almost 140 million migrant workers have been adversely affected because of COVID-19. We saw a majority of them lose their income. 78% of workers had less than 300 rupees when they were spoken to by NGOs and CBOs as they walked to their homes. And so although we have always supported NGOs, we have looked at it more from the business and corporate lens to form a social compact. It's a business civil society initiative. And Dasra, NGOs, people from the ground and voices from the ground have been really key in pulling this social compact together, which has been rolled out so far in Mumbai, Pune, and in Ahmedabad with different industry types. And the hope is to really spread this initiative across India so that it becomes a norm, very much like we have green norms in all our companies that we need to adhere to. This too needs to become a norm of how we treat the most vulnerable and the people at the sort of most bottom of the pyramid in our organizations.
Thank you so much, all three of you, for a fantastic panel. I really appreciate all the great work you've been doing, not only before COVID, during COVID, and more importantly, what lies ahead of us.